Hi, I'm Greg Wheeler, and I am a community pharmacist and the owner of Skaha Pharmacy in Penticton, BC. I've owned Skaha Pharmacy for about 10 years now, and at Skaha Pharmacy we've been the renal contract pharmacy for the BC Provincial Renal Agency for approximately the same, about 10 years since I've owned Skaha Pharmacy. In BC, with that contract, we deal with all the dialysis and chronic kidney disease patients in the community, and they get all their medications filled here. That's on a formulary for BC Provincial Renal Agency, or BCPRA. Throughout the 10 years, we've noticed over time that a lot of these patients had a lot of medication discrepancies over the when they would come away from their clinic visits. And we also noticed, because of that, we were doing a lot of phone calls and faxes to the CKD clinic trying to resolve these issues, and eventually over time this led to some tensions between the different staffs from the clinic and the pharmacy, some strained communication issues. And I believe about 5 years ago I had an idea that if I could get a community pharmacist to be part of that renal clinic and be part of that primary care team on a regular basis, that we could reduce the number of medication discrepancies that our patients had, but also improve the communication because we're there on a regular basis, and hopefully make it more efficient and effective at the clinic, and because they're not going to be receiving all kinds of faxes and phone calls from all the community pharmacies. So I proposed the idea approximately 5 years ago to have that collaboration happen. But at the time there was no funding within our Interior Health for that type of collaboration for a community pharmacist. And so the idea got shelved for a little bit. And then in BC we ended up getting approval for clinical services and medication reviews, funding through our PharmaCare system. And that led me to revisit that idea again with the manager of the Chronic Kidney Disease Clinic, or the CKD clinic here in Penticton. And then of course it just snowballed from there, and we ended up to where we are today. That process, once I had that first initial meeting with her, the manager, it took us about 7 or 8 months to get to the pilot project stage. And that involved forming a steering committee, putting a very detailed format proposal into Interior Health, and then making sure that our training was up to par, so basically upgrading some of our training as community pharmacists to make sure that we were hitting standards within the Interior Health, and then putting forward an independent evaluating team in Interior Health that could look at how our pilot project was working. So that all took about 8 months, like I said, and once it got started, we did a 3-month pilot project. The independent evaluation team ended up doing some tabulating the statistical data as well as the cognitive data as well, through interviews with our team members, other team members, and with our patients. And eventually, it's about 6 to 8 months from the beginning of our pilot project, we've got a long-term commitment from Interior Health to continue to have a community pharmacist on their CKD team. So basically collaborating on a primary care team, which as far as I know, there wasn't a whole lot of community pharmacists who were doing that type of work to that extent at that time. Just to describe what happens at the clinic is the patient will come in, they will initially be seen by the nurse, the renal nurse. The renal nurse will basically take their weight and do a blood pressure test, and then do a small quick interview focusing on nursing issues, and then they'll walk the patient down to the pharmacist in a different room, and along with the patient chart, and the nurse will give us a quick brief summary of what she has found, and then we are going to do our full medication review at that point, The average time is about 12 to 13 minutes per patient is what the pilot test eventually came out to show. Some are shorter, some are longer. Once we've gone through our whole medication review and our interview and look for any discrepancies and come up with any recommendations, then we will take the patient then down to see the nephrologist and we will give the nephrologist our summary with the patient chart. And then the nephrologist will do their thing, and after that visit they'll either send them to the renal dietitian or home, depending on what their needs are. You know, throughout this, and you've got to hear from one of the nurses, it's certainly, they used to be responsible for doing the medication review, and they would basically do a medication reconciliation, not an entire review. But just by doing that part of it, it has certainly freed up a lot of their time to concentrate on more nursing issues, which was one of the goals at the beginning. Other things that have come about because of this collaboration, for one, we have developed new friendships socially with our other team members, and we do a lot of social events outside of the clinic time, which is very fun and exciting. We also all the community pharmacists are now invited to all the nephrologist journal clubs that they do for their own CE events, and it's a social evening as well. So it was very exciting to be part of that now, and what a way to say that was fantastic collaboration, not just at the clinic, but we're now collaborating with the physicians on a regular basis outside of the clinic. As far as job satisfaction for our community pharmacists, it's been a fantastic experience for all of us to be able to utilize the skills that we were trained for originally to this extent, and to see the difference that we get in patient care on a day-to-day basis with our patients that we now see in the community, in a dispensing environment at the community pharmacy, but also now as part of their primary team at the CKD clinic. And also, lastly, but not least, is to say that throughout, if people are copying what you're doing, it's a testament to the success that you're having in our program. And we are now seeing the program being expanded within our region to 2 other sites now already that have started, with at least 2 other sites getting ready to go. And now we have interest within the British Columbia BC Provincial Renal Agency to expand this program in our model provincially. And that's very exciting to me.